In our School of Nursing, faculty are not only teaching, but they're also conducting their own research. We want to have our PhD graduates take on the role of nurse researcher, so they in turn can make new discoveries, development of knowledge to inform practice and improve systems.
Here at the Madison School of Nursing, we have a lot of great diverse faculty with really broad areas of research. So it was really easy to find a mentor that actually had an area of research that was consistent and related to my area of research.
Working here with the faculty and learning from all of them and their expertise, but still being able to refine your own program of research is super rewarding. In my role at the hospital, I help nurses use research to guide their practice, and I became really frustrated with the fact that there were a lot of questions that hadn't been answered, and the only way to answer them was to do research. I felt limited because I couldn't do research, and so it went from I'm never going to get a PhD to when am I going to get a PhD to where am I going to get a PhD.
Earning a PhD is not just about content. It's really about gaining skills to develop new knowledge. So it's a different skill set than most nurses have had before.
All your knowledge as a nursing undergraduate BSN, it is foundational to what you'll be doing as a PhD, but the PhD uses a whole different part of your brain. And it's fantastic because now you have this wisdom to combine your nursing knowledge that is very much clinical and hands-on, combined with this other knowledge of research and skills and leadership. And so having that together just means that you'll be able to make really broad impacts and affect big policy and practice changes.
I think that's one of the biggest benefits of going to school here is that we have this rich group of faculty members who just bring this incredible expertise both in their research area but also in how to mentor and guide PhD students along the path to get them from a first semester student all the way through to graduating and achieving your PhD and being able to provide that support, and they're super accessible.
We're also intentional about having face-to-face classes. This means we have small classes and frequent contact with faculty. In addition though, our students have the benefit of the entire campus and the breadth of research being done there.
You have access to not only the School of Nursing, but all the schools on campus. So if you want to take, classes within the School of Medicine and Public Health, School of Pharmacy, Sociology, I took classes in the School of Business and Industrial and Systems Engineering, and beyond. Some of those courses were the best classes that I took because it just gave such a different lens. Because you're at UW-Madison, you have access to all of these courses, plus faculty.
Because our program is mainly in person, we actually are a really tight group of people where all of our peers actually kind of work together from day one of entering into this program. We take all of our courses together. We help each other by asking questions about our topic. How are you going to look at this? Have you considered this? And they're constantly being used as a peer reviewer when it comes to our work.
We're committed to developing nurse researchers, to develop new knowledge, to inform what nurses do in practice, and how to improve our healthcare systems.